Well, the high point of my day was that my staff entrusted me to carry the bill up here. So we're here today to celebrate another bipartisan victory involving moving things forward for the state of Oregon. In this case, creating a robust health insurance exchange that will bring significant benefits to small businesses and to consumers across the state, and also play a pivotal role in the larger effort to reform our healthcare delivery system to improve quality, improve the health of Oregonians, and significantly reduce costs. Before we sign the bill, I want to just acknowledge some people who were critical in getting us here. The Health Insurance Exchange Board, under the leadership of the Chair, Liz, there you are, Liz Baxter, Vice Chair Terry Andrews. Where's Terry? Is Terry with us? Terry? Representative Mitch Greenlick, who will speak in a moment, and Senator Montes Anderson, both have been champions of the Health Insurance Exchange over the past year and gave us the ability to get here today. Rocky King, the Executive Director of the Health Insurance Exchange, and Amy Farber is Deputy Director. Rocky will go down in history as almost single-handedly killing the bill by not stopping his testimony. And finally, the chair of the subcommittee promised to vote the bill out if he would stop. Also, I want to take a moment to thank the staff of the Health Insurance Exchange and some other staff members. I think it's very fair to say that in many cases, the people who really get things done, who make the biggest contributions, are the folks who are behind the scenes. So I'd like to thank Nora Leibowitz for her courage and for living by faith as her co-pilot. 2 years ago, she and Barney Spate, which is takes a lot of courage in itself, wrote the very first health insurance legislation that created the Health Insurance Exchange. Tris de la Rosa, obviously someone who's not risk adverse. 2 years ago, or a year ago, in June, when we signed the Health Insurance Exchange, not knowing whether she was going to get paid, not knowing whether she was going to have a permanent job, left her job at Salem Hospital, became the first employee of the Health Insurance Exchange, and helped bring up the public corporation. So we definitely want to thank her. Kelly Harms and Lisa Morosky put together the business plan that was actually approved by the legislature in House Bill 4164. So thank you very much. And then there's Carla Messerholt. In every organization, there's somebody that holds it together, that provides the glue, that makes sure that the payroll is met, and that there's a roof over your head, and that the computers work, and the telephone works. And Carla's been doing that for 23 years, almost a quarter of a century. Bringing up OMIP, the small business plans that were offered under the Insurance Pool Governing Board, implementing FIOP and the Healthy Kids Connection, and now the Health Insurance Exchange. An individual without whom Oregon would not be at the forefront of national health care reform. So I just want to acknowledge the tremendous work of Carla. And finally, I just personally want to again thank Mike Bonetto and Sean Colmer, who really were the glue inside the building. Without their magic, we wouldn't have gone from a group of 50 or 60 people a year ago to being here today signing the second of two very, very important bills. Thank both of you. I'm just going to say a couple of things, and then we'll turn it over. We have a couple of other speakers. I just want to say that, we've all felt from the beginning that it was very, very important for the state of Oregon to design and implement and operate our health insurance exchange rather than defaulting to the federal government. And I think this exchange is going to provide significant benefits to small businesses, significant benefits to individuals. It's going to give us the ability to compare insurance plans based on quality and cost. It's going to provide assistance in how you use health benefits to actually improve health. It's going to be a resource for this state, and starting in October, I believe of this year, it'll be accessible to Oregonians through an easily accessible website, through a toll-free number, and also through insurance agents and community-based organizations. And it is going to be a central contributor to the success of a larger healthcare reform effort by setting the standards for plans to ensure that they reduce costs, that they maintain quality, and that everyone has access to the kind of coverage that they need and deserve in the state. So this is just a great day for Oregon. I mean, I'm not sure I would have believed 2 years ago that we'd be standing here all together with these two bills that passed with huge bipartisan votes, and I think is the first step towards really transforming healthcare here in Oregon and hopefully in the United States of America. So let me introduce Representative Ms. Greenlee.
Thank you, Seth, for all the good work they did on this. I was recounting on the way over the number of years I've been trying to move us toward universal access to affordable and effective health care, and I'm in the 5th decade of doing it. And through that whole time, I've had my friends telling me, well, the only way to do it is with a single-payer system. That's the only way, and I've always contended that I think the Oregon way is a different way, and that we could move in that direction and achieve it eventually through public and private partnerships. This exchange moves us dramatically toward the ability to provide universal access for our citizens. And it's a very important step just in the transformation and where we'll be going in the next session, in the session after, and the session after that, to ultimately arrive at that last station, universal access to affordable and effective health care for every Oregonian. This is an important stop.
Good afternoon, everyone. I'm State Senator Lori Monis Anderson, and I represent Gresham, Trout, Elwood Village, Fairview, and now a little bit of East Portland. But I look out in the audience here, and I see so many people that I've really gotten to know very well. The insurance companies, the staff, the governor's staff. A lot of bipartisan support went into the work of this bill. And it really is an honor and a real privilege to be present, I feel, on this very historic day. The Oregon Health Exchange, I firmly believe, is critical to the future of healthcare in this great state. The exchange is going to help expand health coverage. It's going to improve outcomes for countless Oregonians. The Oregon Health Insurance Exchange will create choice, transparency, and accountability. It will hold participating health insurance companies accountable to standards for service, quality, and value, and it will help consumers make direct apples-to-apples comparison between the different health plans. The Oregon's exchange is not going to replace the health insurance system as it stands now. It will only augment it. It will enhance consumer options rather than limit them, and it will offer a competitive environment with many plan choices. The exchange is going to help small businesses and employees by making it easier for Oregon small businesses to offer health care coverage. So many are not being able to do that now, and that's one of the great things that we're going to be seeing in the future. The exchange will take our state's specific needs into account with a consumer-driven mission and local control. And House Bill 4164 is of public interest. The exchange is going to empower Oregonians by giving them the information and tools they need to make health insurance choices that meet their needs and values. I'm so excited to be a part of this signing ceremony.
Finally, we have Steve Ferree, who's a small business person here in the state of Oregon, who's going to make a few comments. Hopefully one of the beneficiaries of the exchange.
Yep. Thank you, Governor. Thank you, Governor. Thanks for being here, everyone. My name is Steve Ferree, and I own Mr. Rib Plumbing here in Portland. And I just want to speak a minute. I'm the Vice Chair of the Consumer Advisory Committee, part of the exchange, and also Vice Chair of NFIB, National Federation of Independent Business. But as a business person, you know, I think one of the things this thing really does is really can, you know, help us with some of the escalating costs and also provide different options for employees. Every year, myself and my lovely wife, Michelle, we sit down usually around June and spend, you know, a good 2 or 3 weeks going through all your plans. We try to provide a good plan for our employees. And we have roughly 31 employees. And in doing so, sometimes the current plan you have, the rates go up 28%. And sometimes you have to make the tough decision to switch to a different carrier. Now you have people that their doctors aren't a part of that carrier. With this exchange, as an employer now, I can offer all these different plans to our employees, and they have more choices. And it really helps the employee besides the employer. So I think that's really key. The other thing is there's tax credits for helping with premiums within the exchange. I think that's very helpful for both employee and employer, and a very strong case for why this should work. And then the other thing, the last thing I want to do is, firstly, I want to thank some folks. All the folks on the Consumer Advisory Committee put a lot of hard work in, the board members, and also the staff of the exchange. I've worked directly with a lot of these folks, and I've seen how hard they've worked to put this together, and they're doing a great job. So I think we're heading in the right direction. The other piece is, I don't care if you're a D, an R, or an I. The reality is, this really has been a collaborative effort. People coming together to make healthcare better for Oregon. So, thanks everyone.
Thank you, Steve. We have some other legislators who joined us today. I particularly want to recognize Representative Kotek, who has been instrumental in actually helping us move this legislation through the intricacies of the House of Representatives. Having served only one term there, I still don't entirely understand it. You'll be glad to know that I promised Sylvia that once this last bill is signed, I will take time out to get a haircut. So with that, I'll sign the bill.